I think the Westminster chimes there are indicating it's just about time to start.
It looks like it's 10:30, folks. We'll call the meeting, December meeting of Neighbors of Dunn County to order. Roll call. So it looks like everyone is here on the committee with us, and also Chair Bartlett. Everyone should have reviewed the minutes. Does anyone have any questions on the minutes? And hearing none, is there a motion to?
Supervisor, yes. Can you hear? Well, I don't know if it's a question. I just know I have such trouble nowadays with the Zoom meetings of maintaining continuity and understanding what's going on. I just wonder if the minutes could be just a little more details. For example, did we say that Arrowhead was closed last time? Something like that might be on the minutes, because then I can look back and say, okay, it's closed. Oh, now it's open this month. It just things to help me a little bit, not the whole shebang, but just to kind of help me look back. Like, we had a great discussion on contingency plans. And if I was a public and I saw that we're working on it, that kind of helped me out, but it helps me out personally. So just if we could have just some of the main important things as details, I'd appreciate it.
We can do that.
You don't want word for word, Mike. You just want a little more information, right?
I'm so slow and my memory is bad.
I do have one comment on the minutes. I believe Supervisor Kennedy was with us, but she may have been just a little late. Is that correct? Sarah,
yes,
are you there?
Yes, it is correct.
Yeah, that's what I thought. Is there a motion to approve the minutes? Do we have a motion?
I'll make a motion.
Okay, Supervisor Kennedy moves.
Second.
Supervisor Jensen second. Any other questions on the minutes? Hearing none. All those in favor say aye.
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 Opposed? Opposed? Carried. Okay, public comment. I don't know of any. Is there, Carmen, do you have any public comment? No? Okay, we'll go into the administrator's report then.
Right. Thank you, Chairman. So as always, the first thing on our report is the Quality Assurance Steering Committee updates. So this month we went over our quality measures with the nursing, the Quality of Care Committee gave their report on quality measures. The only thing that was notable was we had seen an increase in falls and falls with injury. All of those have been investigated. The majority of them were from a couple outlying individuals. It was not a trend of having increased people falling. It's just certain individuals that are frequent fallers kind of skewing the numbers. So that was the only thing. And we talked about that and looked into possibilities for those individuals as well. That was the main thing from the Quality Assurance Steering Committee outside of the obvious of COVID, which we'll get into a little bit later. Any questions for QA? Okay. Next is the employment activity report. So I will let Chris address that.
Good morning. Can everybody hear me?
Yep. Good morning, Chris.
Morning. So this got sent out. So the number of interviews scheduled was 3. We held 2 interviews. I think we had a no-show. That's why the number was down. Then the number of positions offered was 2, accepted was 2, and we didn't have to offer higher than a step 3 because we didn't hire any nurses. Resignation reasons are listed there also. We had a couple part-time LPNs, 3 part-time LPNs that had left. One moved out of state because of their spouse's job. One was just personal reasons. The other one went to Mayo. Then we had about 4 part-time CNAs that had left. One moved out of state. One wanted to work closer to home. One went to Mayo, and then one refused to work holidays or provide care for COVID positive residents. So then we go down to open positions. So those were adjusted a little bit due to our hiring and resignations. Active leave of absences is the next box down, and that stayed about the same with the students on leave. Hoping to get a few more students once some of the schools went virtual, but that hasn't really paid off a whole lot. And then work comp hours, it was a very good month for work comp or workplace injuries. We didn't have any lost time injuries. So I kind of did a rough tally of missed shifts for November due to COVID-19 issues. And this is kind of all encompassed. Some of them were eligible for the emergency sick leave, some weren't. That's all one chunk of numbers. So it was about 234 shifts, or roughly 1,900 hours missed due to COVID-related issues. So it was
230, you said?
234 missed shifts, or roughly 1,900 hours. So.
And I can speak
Oh,
to that
Chris,
a little bit more. Oh, go ahead,
No,
Supervisor.
I'm sorry. I was just thinking that's a big jump from 90 last time.
Yes, it was.
So, wow, you guys my hat's off to you.
So, and I can address that a little bit more too, similar to last month, but this is all encompassing of anyone who tested positive for COVID, anyone who was a close contact of an individual who tested positive for COVID, and then also anyone who needed to be tested because of symptoms. So that was the group of people that would not be eligible for the emergency sick leave. If they say they had a headache or a cough, a fever, any of the symptoms, we require them to be off of work until they have a test result that shows they can come back to work, or they tested positive, and then we go from there. But the individuals that test negative but are out of work for sometimes up to 3-4 days waiting for test results, those hours are also in that total. And depending on the person, a lot of those were filled with agency staff, overtime, or incentive pay. So it is a fairly significant jump, but we are working to capture all those hours in the COVID relief funding as well. Anyone have any questions on the employment activity report?
Nope.
Okay. All right, so moving on, we have the resident referral report. So this looks a little bit scary this month, and to be quite honest, it is. So at the beginning of the month, we had 112 residents at the facility. We had 58 referrals. We only were able to accept 6. That was mainly because all 3 of our neighborhoods were in an outbreak for the majority of the month of November. Only East had residents involved in an outbreak, but anytime there is a staff member that tests positive, that facility goes into an outbreak. And then for 14 days after that staff person tests positive, the unit or household they work in cannot admit to that household. So at one point, we had no beds at the facility on campus that we could admit to for a significant chunk of time. So the main reason that these individuals were not admitted to us was because we couldn't, and that is per state regulation. So we had 6 individuals admit to us over the month, 52 not. 18 were those that we could not admit because of regulation. 8 were people who were positive with COVID. 5 went to their first choice. 4 were swing bed, and 1 was a facility closer to home. 2 were not in network with our insurance. 7 behavioral health issues. 5 expired at the hospital, and 7 went home. In total of all of these, we are seeing changes in referrals as well. We are not the only nursing home that couldn't accept. To be honest, the hospitals are filling up not only because there's more people sick, is that they don't have anywhere to send them. Most nursing homes are in an outbreak at any given time. So we're seeing referrals from people that live very far away from us, that we might be the closest place that could admit, so they're trying everywhere. So it's pretty sad because we can't admit people, and then the hospitals don't have room to take care of people that also need to be admitted to the hospital because they're full. So it's creating a huge backlog. So right now we are at the end of the month, we had 105 residents in the facility, which is the lowest we've been in quite some time. We had no residents transfer out of the facility. We had 5 deaths and we had 8 discharge home. We do have Arrowhead closed. It has continued to stay closed. And Central is currently reduced staffing quite significantly because we have very few people in Fireside as well. We are seeing an increase now. All 3 neighborhoods are out of their outbreak. We have not had any positive staff or residents in more than 2 weeks. Actually, we're over 3 weeks now. So we are not in an outbreak at this time. So we are able to admit. So now we're juggling the admissions, trying to get them in while still staffing at the level need be without increasing. But then once we do need to increase, we will to meet the needs of residents. So at this point, we are still limiting staffing to not add the extra cost and staff to the number of residents we have. But we are now able to admit, so we are trying to get as many people in as possible to fill up some beds. Any questions on the referral report? Okay, and then I will move on. Next is the environmental and facilities report. So I'll give it to Scott.
Hello, everyone.
Good morning, Scott.
Well, with the lack of snow to move around, guys haven't had as much outside to do. They've been concentrating on inside things, working on work orders and repairing, just minor repairs on equipment I've been lately. Looking at digging in deeper as far as the geosystem to fine tune that and run it more efficiently than it has in the past. We had the last heat pumps we had repaired by Docile Geothermal out of Rice Lake, and he seems pretty knowledgeable about the system as to where we can run it. We did the lockout on the thermostats, which proved to be not worth it because the thermostats don't lock out by computer actually, so people still adjust them. But I think we've gotten a handle a little more on the thermostats as far as people messing with them and adjusting them. It's gotten a little better. Looking more into what we can do with that. I'll contact Johnson Controls themselves to see if there is a way that we can lock out the thermostats so that people aren't messing with them. I think our last meeting, I reported we had a new custodian that started through Express. Seems to be doing good. I haven't had any complaints on that part of it. Other than that, it's heading toward the end of the year to finish up yearly things. That's about it. Any questions?
All right, thanks, Scott.
Thanks, Scott.
So next on the list is infection control survey. So as I might have mentioned in past meetings, nursing homes do receive infection control surveys when a positive resident occurs. So if there's a resident that tests positive for COVID-19, we receive an infection control specific survey in that building. And then we are cleared for 12 days. And then if we have new residents that test positive after those, or 14 days, and then after those 14 days, if we have additional residents that test positive, they would return for another survey. But during that time frame, your additional residents would not, but after that, they would return, and you have to have 3 or more. At this point, we have had 1 infection control survey in the East Building from our outbreak with residents. That was on the 24th of November. We had one surveyor that was in the building, did a full survey of infection control. She was in the building for maybe an hour or two, and then did the majority of her survey off-site with record review. So they also try to limit their time in the facility to prevent any spread to the facility or to them, as they are in all of the facilities in their region throughout the week. So they are trying to limit that as well. The surveyor came in, she observed PPE usage, she observed donning and doffing PPE, hand washing, policies and procedures. She watched testing, everything that kind of are the big topic things that she could observe. And then in record review, she did record reviews of the residents that had tested positive. She requested testing schedules and proof of testing of staff. So they picked staff members at random, and we had to give them test results to show that the staff were tested per the twice a week, which we are still doing. From that infection control survey, we did not receive any citations or anything that the surveyor thought we were doing wrong. The upshot that she gave to us was, this is happening everywhere. She said in the last few weeks, there has been many nursing homes that have been completely clear of COVID through the whole pandemic, and all of a sudden they're popping up with large outbreaks. So her thought on it was that maybe the virus is getting more infectious or more airborne. She wasn't sure, but she thought that it was odd that our protocols had worked for so long, nothing has changed, and then there's an outbreak. And she said that this has happened in almost every place that she had been in the last few weeks. So it was nice to know we weren't alone, but still we weren't offered any answers as to why this is happening. So we were relieved to not receive any citations, but we also didn't get any answers of why we had an outbreak. So unfortunately, we still can't fully determine where the outbreak started and how it spread. Any questions about the survey activity?
Well, I have one question about the 4 residents that tested positive. Did they recover all right? Did they get real sick or?
So we, I guess I can get into the COVID stuff
I'm
as
sorry.
well then. No, that's okay. So a couple of things. So with COVID-19 and our outbreak in the East building, we actually ended up having 12 residents test positive for COVID. So we had 12 residents that spanned across all 3 households. One household only had 1 resident that tested positive, and then the other the other 11 were spread out between 2 other households. Of our outbreak, our outbreak has ended. We have not had any new positives. Our last confirmed positive was on 11/24. So we are 3 weeks out now from our last confirmed positive resident. We had a few deaths. We had a few people that had severe illness. A letter is going out to the families this week regarding that. So that'll address the fine details of that. So we want to wait till that letter goes out to have it be public knowledge so that it goes to the families of the residents in that building. But our outbreak has since cleared, but we did have a few people pass away. And then a few others that did have severe illness that fortunately have recovered. But in total, all of our residents that have tested positive have either, unfortunately, the few that passed away, and then all the other residents have now since recovered. So we do not have any active cases of COVID-19 in the East Building at this point, but we did have 12.
Oh, it's too bad.
was a very tough month for the residents, the families, and the staff in the East Building. It was a difficult situation with staffing as we did not want to cross-contaminate. So we couldn't have any staff that were over in Central or West go into the East Building, which we try to do anyways, but we were very strict on it throughout the outbreak. So this also added extra stress on those staff in East as well. For example, helping with the dinner rotation that we've talked about in the past. We didn't want the management staff from the Central Building going over and helping in the East Building at night because they come back and see residents in Central and things like that. So it was a challenging month for all over in the East Building.
One question, Brian, for Carmen. I'm curious, for people that are close to the end of life, is anyone allowed to visit? Relatives, whatever?
Yes. So at the beginning, we had talked with public health about this, and they advised us not to. They said, no, it's a risk to the general public. Since that, when we had our survey and talked to surveyors, they had said, we encourage you to, this is their last chance. So we kind of got stuck in the middle of that. So at the beginning, we did not. But then we really did think about it of as long as we educate the family, they're wearing full PPE. This is their last chance to see their loved ones. And that if that's a risk that they want to take, then we would encourage them to isolate or anything like that after leaving. But we have been allowing people as and the humane thing to do for our residents and their families. Any other questions about the outbreak specifically? Okay, so I'll go into a few other things about COVID-19, which I'm sure the big topic one is the vaccine. So there is hopefully a little bit of a light at the end of the tunnel. So as you probably are all aware, last Thursday, the Pfizer vaccine was granted approval. And has now been distributed and started to be given. I do know that in Eau Claire, there has been some clinics and hospitals that have had it. I do not know for sure. I believe Mayo here as well has had some vaccine distribution. The skilled nursing facilities in the United States have been partnered with either CVS or Walgreens to have our vaccines provided to us through them. We are partnered with Walgreens. So in the next few weeks, we will be setting up clinics through the Walgreens program. It had to be initiated by the state, which this process takes about 2 weeks. They initiated it on Monday. So the earliest we would see it is the week of the 28th. There's not going to be enough vaccines for every skilled nursing facility in the state. So hopefully sometime in January would be my prediction. We may get lucky and be in that first wave, but I don't know how they will decide who gets it when. So the state will send the vaccines to the contracted pharmacies. The pharmacy will come to our facilities and will vaccinate our people for us. So they will do the actual vaccination itself. They will do the paperwork as well as the storage and then the submission of the vaccine data into the Wisconsin vaccination system as well. So it'll take a lot of staff time and stress off of our staff as well. Supervisor McCullough, do you have a question?
Just wanted to add a little piece. I was in an emergency planning meeting this morning, and one of the reasons the state is playing it very close to the vest with who's getting what and where is they've had apparently credible threats against the vaccine supply. So that is a thing that people should probably be aware of.
Yes, I know they didn't release. So the Pfizer vaccine is the one that has to be stored at a very, very cold temperature. So for that vaccine, they are doing a hub and spoke model. Which basically means they're sending all of those dosage to the hubs. And I believe Wisconsin has 8. They did not say where those 8 hubs were. They were trying to protect that knowledge so that they wouldn't be broken into on security reasons. And then those hubs would be distributing those out further. We will most likely be getting the Moderna vaccine. We are not part of the hub and spoke model. If it is approved today, I believe it is up for approval, or a different vaccine that doesn't need to be stored at the cold temperatures. At this point, the state and CMS has advised nursing homes to have the Moderna just out of logistics once it is approved. But yes, I do know that that security issue has been a big problem. So I don't know how Walgreens will be transporting the vaccines and the people to do them to us so that there isn't security threats on the way in and whatnot. But I do know that that is a consideration to keep in mind. Any questions about the vaccines? Okay.
What would be the protocol on employees getting the vaccine?
So this has been a discussion that I have had with Paul and Heather and KT as well. Our organization is a little bit different than the overall employees for the county. Similar to the flu vaccine, we cannot mandate vaccinations. What happens with flu is if someone does not get the flu vaccine, they are required to wear a mask throughout flu season. At this point, what we are anticipating doing for our staff is once the regulations of wearing face masks and the goggles and everything like that are lifted, if they did not get the COVID-19 vaccine, they would be required to still wear the PPE that we are currently wearing, which I can tell you a lot of our staff would get it just because of that. We've been wearing face masks now since early March, and then the glasses as well now. And a lot of staff will be really excited to not have those on 24/7.
Thank you.
Mm-hmm. And as far as resident goes, we cannot mandate it also. We are strongly encouraging it. I do know we've had a ton of questions already. We are in the process of getting our consents ready to send out. We have to know what vaccine we are getting to send the consents out, because someone might consent to one and not the other, depending on their views about it. So after today, hopefully, if the Moderna vaccine is approved today, we would send out information with that, because that is most likely the one we're going to get. And then we'll see on how many consents we get back from our families. Supervisor McCullough, did you have a question?
Just another thing from the emergency planning. OSHA is anticipating that at the end of January, they may be able to issue an order that will allow at least private employers to mandate vaccine for employment. As a creature of the state, of course, we operate under a slightly different set of rules, but that is on OSHA's horizon right now. And I thought that would be probably useful information for all of you.
Yeah, thank you. So we had contemplated that issue with the potential of, are we able to say, if you don't get it, you can't work here? Our only fear is that we are already struggling with staffing, is with how controversial getting this vaccine is, that we might lose half our staff. So we're very nervous about that. So I think after we have the original wave of vaccinations and we have a better grasp at how many people actually turn it down, we can go from there on that as well. In regards to COVID-19 as in general, as I said, we are not in an outbreak in any of our 3 buildings, which is great. It has been a long time since we could say that. We have not had a positive staff member. In West, we haven't had a positive staff member since the 2nd week in November. Central was the 24th of November and East was the 23rd. So we're doing quite well for staff with COVID-19 at this point, knock on wood, but we're at right now holding strong. And then we are also still continuing to test twice a week per CMS and guidelines. So our positivity rate in the county is still above 10%. So we are still required to test twice a week. We are still doing this on Mondays and Thursdays. Right now, we are testing all staff actually twice each time. So we are testing them with a rapid test as well as the PCR test that gets sent out to the state labs. We are doing this because in the midst of our outbreak, we were having very slow turnaround times from our state lab, which we were finding out people were positive several days after they were tested, and then they could have been working the whole time. So we are testing them with the rapid tests, which are less accurate, but still could give us a positive reading. And then also with the PCR test that can confirm the rapid test. This has worked out in our favor twice. We had 2 staff members. This was in the last 2 we had on the 23rd and 24th that tested positive on their rapids. And then we got their PCR ones back later that also were positive. So it prevented them from working 2 shifts each. So that was a good implementation to have to prevent staff from working when sick. Any questions on testing at all?
I don't have a question per se on the testing, but of your employees that have been diagnosed with COVID, have they been mild cases or has anybody had any kind of a real bad case?
So far we've been very fortunate. The majority of our staff have had extremely mild cases, with a huge chunk of them not even knowing they were sick. Most of the ones that all of the ones that we've detected from our screening had no idea they were sick, because otherwise they wouldn't have been here. But there's a ton of people that never once had a symptom. But we have had one staff member that had a more severe case, but not needing to be hospitalized or anything like that, but still has had some residual effects of it, still coughing and things like that. And she was diagnosed in October. So we've had only one that has had more of a severe case. Everyone else has had mild, maybe a cough or a fever for a day or 2. And then, like I said, a handful that wouldn't have even known that they were sick.
Thank you.
Mm-hmm. Does anyone?
Excuse me. I was going to ask, do you know what kind of funding it will be going in 2021 on the expenses?
Sure. So I know Jane does a lot of research on this as well and can probably talk a little more specifics than I can. So there is funding that is continued through 2021. I believe it's until July, off the top of my head, that we are able to use some of that funding. Do I have that right, Jane?
Yes,
July?
you do, through the end of June 30th, and then we need to report that in July. So the funds that we have now, we can use through June.
So we are able to use those funds for covering of our expenses. At this point, I do not know of any additional ones, but they have been kind of just popping up. Basically, they put out information about funding, and then that day or the next day we get funding. So then we have, they're kind of doing it the backwards way. Instead of reimbursing us, they give us a bunch of money and say, this is for spending. If you don't spend it, send it back. So at this point, we are using that funding to cover any expenses that we have in relation to COVID, and making sure we're capturing all of those things, like the times that we had someone off and we were potentially paying someone at a higher rate to cover their shift and things like that. Chairman Bartlett, did you have a question?
Yes, a couple of them. One about the employee that had COVID in October. Now, if that person tests negative and still has like a symptom of a cough, can they come back to work?
Sure. So we do not follow a testing to return policy. Per the CDC guidelines, for someone to return to work after having COVID-19, they must have had a minimum of 10 days since their onset of symptoms or positive test, and then 24 hours that they haven't had a fever and their symptoms have to be improving. So things like the cough or the loss of taste and smell can last for months. So they do not believe that they are infectious. It is just residual effects. So anytime we have cases that are more severe, most of our people have come back right after those 10 days. They've been 10 days since onset and they haven't had any symptoms we've been doing 72 hours just to be extra cautious, but the CDC's guideline actually is 24. We've been keeping 72 because that's our normal prior to COVID. If someone had influenza-like symptoms, they were out 72 hours. So we're keeping them out that extra bit, but most of our people have been able to return at the standard time. So anytime we have anyone that doesn't meet that traditional standard of the 10 days, we work with public health and make sure that public health clears them to come back. So for that individual, public health cleared her to come back once she was improving, but she was out longer than the 10 days. It was probably an extra week or so.
Okay. And then question to follow up from Supervisor Jensen's question. The money you received, you can spend until June, but is there enough money there that it'll last that long, or are you going to run out soon?
We have quite significant extra money in that pool from the funding that we have received. We've been fortunate to not have, we've only had one major outbreak across campus, so we haven't had as much increased cost as some other facilities have had from COVID. So we do have money in that pool, as well as we have continued to receive funding. One of the examples, which is a little bit difficult because they're telling us we can't admit people, but we also have an incentive for admitting people at this point. So if you're in an outbreak, you can't admit, but the government has asked us to admit because the hospitals are full. But so if we're out of an outbreak and we can't admit, we do receive extra funding as well as an incentive to admit people. So hopefully we'll stay out of outbreak and we will be continuously getting that funding as well.
Thank you.
Carmen, are you able to use that funding for overtime and pool help because you're short and you're missing shift or shifts are being missed?
If we can connect it to COVID, yes.
Yeah.
If we can, basically, if we can reasonably prove to an auditor that it was a COVID expense, we can use that money. Unfortunately, some of those things are difficult to prove that it was COVID. We may be able to know that, but if you look back at our previous short-handedness prior to COVID, that's something we have to make sure there is clear evidence that it was COVID related. So when we're having to fill someone's shift because they are out with COVID and they would be a more expensive person, that would be something we can exactly draw back to it. But just being short and having shifts not full, that may not be covered. We just have to make sure we have evidence that it's COVID.
Okay, thanks.
I have one more question. Is this going to be an annual thing, getting the vaccine, or is it just a one-time deal?
I actually do not know the answer to that at this time. I think they're thinking that this is going to be, it's actually a 2-part vaccination. So you get a vaccine and then depending on which vaccine it is, it's 21 to 28 days after the first vaccine, you get an additional vaccine, additional dosage of it, which is common for different viral vaccines. There's a handful of them that you get when you're younger that you get multiple times, kind of like a booster. At this point, I don't know if it is clear how often these would need to be taken. I think they'll be able to tell once we hit that year mark and see if people are still immune. after they've had it. So that'll take a little bit more research. It's just still a little too new.
Okay, thank you.
Mhm. Anyone have any other COVID-19 questions for me? Okay, so we'll move on to census and case mix. I always keep this on here. We've already talked about it a little bit. Our census is significantly down, primarily due to not being able to take admissions. We have seen an increase in referrals, but I also believe that increase in referrals is partly due to getting referrals we normally wouldn't. So coming from distances away that typically they would go somewhere closer to home, but when they try to refer to the places closer to home, they aren't able to take referrals either. So we are seeing more referrals, not necessarily the best ones, but if we could accept people, we would accept people from further away too. If we are the closest person to their home and they're being referred to us, we would accept them if we can. So we're trying to get people in at this point now that we are out of an outbreak. But unfortunately, that could change at any moment if a staff person tests positive. So we're working on it and trying to manage the cost of staffing as well to meet the needs of residents. So staffing to our census as well. Any questions on census? Okay. Does anyone have any other questions for me? All right, then that concludes my report. Thank you.
Thank you, Carmen. We've all had a chance to review the vouchers. Are there any questions on the vouchers? And I'm sorry, I have to apologize. I can only see 4 of you at a time. I'm on a different computer. I'm sick of this stuff. But anyway, so you'll have to yell at me. I can't see everyone. But I can see Mike right now.
Okay. Okay.
Go ahead, Mike.
I'm just curious. I'm curious what on one of the things it said COVID response expense. COVID response expense. Is that what is that?
Supervisor Kinnear, are you talking account number name or account title?
Oh dear. That's a good question there.
You may be. We did create at the onset of COVID-19 an account number by that, and we asked departments to the extent reasonable to put their charges that were specific to COVID only in those accounts so that we could use that for tracking and reporting. That would be non-payroll related type of charges and non-capital asset charges. So it could be things as simple as sanitizer or things like that, if that's what you're referring to.
Well, I'm looking at it here, and it says COVID response expense nursing, number 4110. It's probably the same kind of thing, though. Huh?
Yeah, so every department on those lists has its own account or grouping number, basically, and then so that would be what nursing has allocated to COVID. So if they ordered more PPE or anything that the nursing department would have expensed that we want covered by those COVID funding dollars would go into that if possible.
And one benefit of this is it assists Jane and Carmen and myself in doing the reporting that we're going to have to do out to track this. If all of this information was spread out across all the account numbers, you can imagine the challenge we'd have trying to compile that to claim these. So this was the effort to at least help somewhat bring all that information together in one spot.
Thank you, Keith, but that would be a nice challenge for you. All extra time you could spend trying to figure that out.
I think we've got enough challenges. Thank you, sir.
Are there any other questions on the vouchers?
Well, as long as Supervisor Kinnear brought up the COVID response. I had noticed that was in there a few times, but there's one time that there's a name after it, Christopher Hassenberg. I can give you any of the numbers or whatever. It's on the third page of the vouchers.
I believe that is our IT connection. It goes under his name, but he's our IT person that gives us the equipment. So it kind of goes through that subcontractor.
Okay.
So that would be for technology that we bought that could be used for residents to communicate with families when we couldn't have visitors. So that was covered under COVID funding. So that would be why it was coded there.
All right. Thank you.
Any other questions on the vouchers? Hearing none, we'll get into Jane's financial report.
Okay, thank you, Chairman. Continuing on with the campus census, which Carmen mentioned was down dramatically. We're still heavier on the Medicaid side, excuse me, and lighter on the private pay and Medicare A side. So that does, the case mix change will affect our revenues somewhat. And that's the census mix. The pool staff report of what we've paid out in November. We're still on a lot of previous months' invoices. So in December, that'll end up being higher where we catch up with the month end. So November, we're paying October invoices. It's the total is $144,931, but it's still lower than our monthly average. So yep, pool staff is more expensive and we're using more of it. That is true. Any questions on the pool staff report?
Would it be possible to give us, I know not everybody is at the same price, but like for RNs, and I realize that benefits make a big difference too, but could you take an average of like what our RN cost that actually work for the county, and then let us know how much extra we've been paying for the pool help for these, like just for the bottom figures that you have down below?
Like a cost per hour
Well,
average?
I guess I was wondering is you've got the totals down below of RNs, LPN, CNA. If we could have what the average would have cost if they were our employee compared to pool help, what that additional expense has been on the neighbors per year, like for this last year.
Yep, that is something that we calculate with the cost report and the auditing. And we can get that year-end total once we close out. Would January be okay? Or
yeah, that's fine. I just thought it'd be interesting to know how much extra it's costing us to have all this pool help against our budget every year.
Another interesting point would be how much is the pool staff costing us more per hour per segment this year than last year?
Yeah,
and that may be the way to identify the increase in COVID expense. Right. Is that difference? Yeah. Mm-hmm.
Thank you.
Yep. Moving on to the accounts receivable aging analysis. We are down to the golden number of $1,254,000, which is another low marker for us. That's good. With the lower census, it'll be a little bit lower again next month, but then we'll be billing more. We'll have more admissions again, so it'll waver. I would hope about that $1.2 million mark going forward. VA, my billing staff Carol has done tremendous work working with the VA getting old claims paid. This month we had claims that were 2 years old that were paid. So they did pay them. So that's a good
Good.
thing.
Mhm.
If you compare the December 2019 with where we are now, you can see the dramatic change, especially in those middle ranges where we're capturing the co-insurance, we're billing it out quicker and staying on top of things. Any questions on the aging report?
I think it looks good. It looks better.
Looks better every month. Yes, we're
Yes, it
happy with
does.
that. Yep, the staff is trained in, and we're always working for more training, but they're getting better. The newer person is learning. To the income statement for the campus. If we look at the actual year-to-date revenue to the budgeted year-to-date revenue, the 13 million to the 12 million, we'll notice that we're up about 1 million. The COVID revenue is in there for $1.1 million. If we take that out, our revenues are off by about $93,000. We're lower. And that's most likely due to COVID because our census was going up prior to COVID and now it's, decreased. So that's one indicator of COVID is that 93,000 that we're off in projected revenues. Expenses. If we look at administration, it's off a bit. We've got COVID expenses, a lot of COVID expenses in nursing services and administration, along with the bad debt posting there. All the COVID expenses that you saw on those vouchers are embedded into this expenses report. So we can pull out part of that. We can pull out the expense, the direct expenses. We can't pull out the labor. So we have to estimate that on a separate spreadsheet. If we, so that being said, labor is high on nursing and MDS. Another point of interest is the property ownership use line. You'll notice it's at the 35% of budgeted. That is where the depreciation is budgeted as an expense. They're budgeted 681 on property ownership use year to date. 6 months of depreciation has been posted, and then there's 6 months that has not yet been posted. So the 6 months that's been posted is included there, and at the bottom will account for that extra depreciation that isn't actually in the numbers yet. So going down, if we add in that depreciation and take away our revenue, add the revenues in, we've got a $628,000 income. That includes all COVID income and COVID expenses. If I take that out, roughly, we're at $128,000 net loss. But now that would include paying the depreciation. So that's where we're at with depreciation year to date. Does that make sense?
And that's the end of October now or November?
End of November.
November, okay. All right. I should have known that.
That's okay.
And Mr. Chair, if I could add something here real
Sure.
quickly. When we look at that net income and having it including all of the COVID dollars, we're still getting additional guidance. Just last week, I was in a conference and our audit firm was actually one of the presenters. Jane has been in them as well, and we're getting updated guidance on how we recognize the revenue for COVID dollars. And it sounds like as part of the year-end reconciliation and audit process, we've learned that these dollars can carry over into next year. So it will change what we will recognize for revenue. What that means is that net income will likely come down because we'll only be able to recognize what we have eligible expenses to report that against. So, and then the balance of that would be reported in 2021 when the money is used. So this is still very preliminary. We're still working through that. And again, the guidance on all of this has been kind of coming on the fly. So, but we wanted to provide you the information so at least you have the awareness that we have that much money in hand at this point.
Thanks, Keith.
Mhm.
Yep.
Question on the depreciation. Why don't we bill that every month?
I think that's an SAP computer issue. We're still finalizing and correcting some fixed asset accounts, and we want to get it right when we do run that depreciation. Otherwise, we're going to backtrack and adjust asset values if the depreciation isn't correctly posted the first time around.
All right.
Yeah,
Is that
Chairman
right, Keith?
Bartlett, you're spot on. That has been the practice in the past. It's just the last several months we're resolving, not in the NDC area, but in other areas. We had some initial setup fixes that need to be made now, working with our software consultants. So we haven't been able to run depreciation.
Okay. Do you have more, Jane?
That is all I have. Are there any other questions?
If no other questions for Jane, is there a motion to accept the review of the vouchers and the financial reports?
So
Mike
moved.
moves to accept both.
Okay, Kelly seconds.
Okay. I think Mike was first for the motion and Kelly seconded it. Are there any other questions? And hearing none, all those in favor say aye.
All right.
Aye.
Opposed? Opposed? Carried. Anybody have anything else at all? Questions, additions? And hearing none, we're adjourned.